Hello and welcome to another interview with Just in Time Worlds. With me today is a doctor to discuss the various intricacies of injury. Toasty, won't you tell us about who you are and how you got into this?
Well, my friends call me Toasty. Mostly it's a nickname because I love bread and I'm brown. I have recently graduated from med school. I now work as an intern at a hospital. As for the writing side of the things, I got into writing at a very young age because my mother, she loved books. That was my incentive for chocolates, for any sort of treat. I had to read a book every week. And I remember picking up Lord of the Rings when I was 12, and I read the first book and I didn't understand anything. It was dense, it was heavy with lore, and I picked the same book when I was 15, and then that was when I actually enjoyed it. Well, I started writing soon after that. I think Lord of the Rings was the first book that got me interested in writing. As for what I do, providing medical advice to authors and writers of all varieties, that's mostly because what I've seen after spending nearly 5 years in med school is that a lot of portrayal of the human body, of injuries, is very unrealistic in all sorts of media. It's not just television, but even books, pretty unrealistic in what they portray things. And I remember one of my friends, he was writing a short story. He doesn't have a medical background. He asked me to come out with a detail, and that is where it started. Now I help authors with all sorts of injuries and other medical details for their books.
And if anybody is interested in more of content around that nature, the link to Toasty's Patreon is in the description down below. Okay, let's start with some injury descriptions. So
Okay.
you shared a post where you went through the various type of injuries one can have. Don't you want to talk us through that, like the difference between a laceration and a bruise and so on?
What a person writes or on television, what it's shown is it's a basic cut. The character was sliced with a sword, and they got a cut on their hand and it's bleeding, and that's what they leave it, and that's where they leave things. But it matters a lot because a cut by a knife will be very different from, say, a cut by a spear, for example. Injuries, while if they fall off a bike, or maybe if they tumble off their dragon while dismounting, will be very different from injuries sustained, perhaps a stab wound. So what the most basic injuries that I don't see anywhere in fiction really, but mostly because it's boring, are scratches. And I think scratches are something that are very common, that most characters will have. That it is basically, a scratch is a superficial cut. It barely breaches the skin. There's a drop of blood, maybe there's two drops of blood. It's a very interesting tool to introduce poison into stories, because you don't need a lot of poison to have a scary amount of poison. A single nick with perhaps a potent poison is
Mm.
pretty amazing to cause serious injury that doesn't appear to be a serious injury.
In a pre-our levels of technology society, wouldn't
Mhm.
scratches also be very susceptible to infection?
They would, yes. And mostly because a lot of cultures had some very, can we say, suspicious ways of dealing with injuries. Reading about an ancient European technique of, applying animal feces, wrapping a scratch up with animal feces to heat up the wound, to kill, the bad air that can potentially cause problems. But what happens is that the feces has a lot of bacteria in it. So what they're doing is making it easier for an infection to take place. What happens is scratches are not deep enough, and they're not, damaging enough. But if there are certain patients, perhaps if a person has diabetes, or if they have some other illness, yes, even scratches can cause serious infections.
Okay. What is the step up from scratches? What's the next?
I'd say a step up from scratches would be a clean cut, a deep cut. The thing is, scratches, they heal usually without scars. As you cut deeper, the skin, the two ends of the wound separate by quite a bit. It's pretty difficult for it to heal without stitches. What we think of sutures, as we call them now, as a modern invention, but they're not really modern. Stitches in some form have always been around, because that is just human logic. You have something that's torn in two. How do you join it? You get a piece of thread and you just stitch it together. The next step from scratches would be deep cuts. Lacerations are a type of a deep cut. When we talk about the skin, we have the layer of skin, then we have fat underneath it, and then finally we have the muscles. So a laceration is basically any cut that reaches down to the fat. These are dangerous because these are deep cuts. The basic principle is that the more surface area you give to the bacteria to grow, the more chances you have of infection. Lacerations, even with modern medicine, lacerations are often infected. Pre-modern medicine, if we talk about pre-modern medicine, and if they have a lacerated wound, I'm pretty sure it will be infected, and I feel sorry for the character who's going to get a laceration.
So just before we move on to some specific questions that I have around cuts, I want to ask something about bruising. I was in an accident, it must be almost 10 years ago now. And it was a fairly serious accident. The car rolled and spun. And I had terrible bruising on my wrist where a tendon got bruised. Now I could move my hand. You know, there was a bruise, for want of a better word, the size of a hen's egg on my wrist. It took months for the tendon to heal from that. So how serious can bruising be?
Bruising can be something as simple as a small pea-sized thing that appears on your hand. You accidentally slam it against a door, to something that can be potentially life-threatening. Of course, we don't call life-threatening bruises, but the principle is basically the same. Bruises is a non-medical term. In medicine, we call them ecchymosis. What exactly happens is a bruise is bleeding, a break in the skin. Your entire body is lined by tiny, extremely tiny blood vessels that we call capillaries, and they are very fragile. I can burst a capillary just by punching a wall. I'll burst a few capillaries if I punch a wall. A bruise is most often caused by a blunt impact. A blunt impact that isn't enough to break the skin, but what happens is that the force of the blunt object that's hitting against your body, it will cause the capillaries to rupture. The blood collect under the skin, and it'll form that characteristic red thing that we call a bruise. And slowly, as the blood is degraded, as the blood is broken down by the body, the bruise changes color and finally it resolves. Your injury that you were speaking about, the bruise that the tendon was bruised, it wasn't exactly a bruise. I think what happened is that there was a collection of blood. That's what we call a hematoma.
Okay.
So all of these bruises, internal hemorrhages, hematomas, all of these are different types of blood being collected inside the body. Now, it might not sound very serious. I mean, you'll say, hey, blood's supposed to be inside the body. But the thing is, our body, you can think of our body as different pouches. There's different spaces that are supposed to be empty. If they fill up with blood, the blood doesn't magically go back to the heart. The heart will continue to pump less and less blood as the blood that's spilling out of the ruptured blood vessels is collecting in these spaces. Now, if it's a small amount, sure, the body can manage it, in small bruises, even in big bruises. But if it's a major amount, a person is in a car accident and they haven't worn their seat belt, they have major bruising, internal bleeding in the stomach. Stomach has a lot of spaces, and the blood is just going to keep getting collected and collected and collected. And as the heart gets less and less blood to pump, the other parts of the body, the brain, the arms, the legs, even the organs of the stomach will not get enough blood, will not get enough oxygen, and they will die. They will slowly die. The blood that is collected inside your abdomen, the organs cannot extract nutrients from that blood. That blood is basically useless.
Yeah, that makes sense. Something that, I mean, I've noticed in fantasy writing and in some movies is Somebody will get cut and it'll be a deep cut. There'll be an arterial blood spray. Let's start with that
Uh-huh.
blood spray. How
Uh-huh.
realistic is that?
It's very difficult to breach an artery with a cut except on very specific locations. I'm actually writing an article about this
Mhm.
where I'm gonna on the body of the human diagram, I'm gonna indicate places where if you get a deep enough cut, you will actually get an arterial, an arterial bleed where the blood is just spurting out like a fountain.
Mm.
But aside from a few places, like I think I can count them on my hand, you can't just slice the middle of your arm. Or if you're slicing deep enough in these places, say if you're slicing your forearm deep enough to get an arterial blood spray, or if perhaps you're slicing your chest or your stomach or your abdomen deep enough to get an arterial bleeding, you're going so deep that you're bound to damage much more than an artery. You're going to mess up your muscles, you will mess up your organs, you will probably mess up bone on many occasions. I don't have a problem with fiction or movies showing arterial bleeding as it's at a proper place. I think the most common and the most easiest place to show arterial bleeding is on the inside of your upper thigh, the femoral artery. It's pretty close to the surface. You don't need too deep a cut to pierce it. And if there's no prompt treatment, it is pretty lethal. The TV show Band of Brothers, I remember watching an episode. They showed this arterial bleeding very accurately. There was an episode where a soldier was shot in the leg, in the inside of the thigh, and the bullet pierced the femoral artery, and the soldier unfortunately died. There is so much blood, and the bleeding is so fast that it becomes even trained doctors to locate the site of the bleeding and to stop it. So if you want your character to bleed a lot, but you also want them to have, like, say, more than a 50% chance of living, I would advise against showing an arterial bleed.
Unless, of course, you have magic.
I think that is one thing that I think fantasy writers get. I mean, when it comes to medicine and when it comes to anatomy, that I think fantasy writers have it easy compared to, say, other genres. That you can use magic as a band-aid, as a magical band-aid.
You can, but only if your magic works in an understandable way. So,
Yeah, I mean, I don't think it's very engaging. For example, say, let's take an example of this soldier. The soldier was shot in the leg and he's just bleeding out and he's going to die. And if there's a magician, he just waves his hand and the soldier's cured. I don't find it to be very an engaging story because there's no conflict in that story. Any sort of injury can be healed.
yep.
Then then the author will have to find an injury that can't be healed by that.
So often what authors do there, or what they should do there, is they should make that magic cost. They should make the cost of that kind of spell very high.
It's important to have a cost for that kind of magic because that is what we modern doctors do. Every drug that you take has a side effect. Every surgery that we do has a risk. Is we weigh those risks against the potential benefits and we decide what is more important.
Absolutely.
If a child has a mild infection, I won't be giving that child an antibiotic that has a high risk of causing kidney failure. Cost should never outweigh the benefits. But if you have a magic that has no cost and only benefit, then that is a story without any conflict.
Yep. I completely agree with that one. We've spoken a little bit about like the arterial spray, but what about the other effects of getting an injury? How does the body react if it takes a deep cut?
Again, it depends on how deep a cut. So let's say you were slicing vegetables and you accidentally sliced your hand or your finger. These cuts, the body's immediate reaction is a massive dump of pain to your entire body. The brain's reaction is dumping pain to your entire body because the evolutionary advantage that this has is that it lets the person know that something is wrong. Okay, I'm doing something wrong, or something wrong is happening to me. So I must change the environment, the situation I am in. That is the first thing that the person should feel. A person is shot and he is having all these thoughts. Oh, I'm shot. They show it in slow motion, but that is not going to happen. The first thing that is going to happen is an overwhelming amount of pain in any serious injury. I'm talking about serious injury. And then the next thing, my body cannot handle what my brain is sending me. And that is what we call shock. That is what we call neurogenic shock. There are two types of basic shocks that I feel authors should know. The first is, of course, a shock that is caused due to blood loss. If you lose a lot of blood, the heart won't be able to pump blood to the brain and the brain will shut down. So you will lose consciousness. That is shock due to blood loss. But the other type of shock invariably happen with injuries, deep cuts, with fractures, the injuries on the serious side of the spectrum is a neurogenic shock. What happens is the brain sends such a overwhelming signal to the body that the body cannot handle it. So the body's and the brain's immediate reaction is to shut down, reboot the systems. Let's see what's going wrong. Let's just reassess everything that is in the body. It's a personal story. I fractured the tiniest bone I can think of in the body. I fractured my little toe.
Mm.
But even that fracture, it wasn't even a displaced fracture. It was a normal fracture, passing out for 5 to 6 minutes. It's very common for a person to fall unconscious after a serious injury. And I don't think this is shown accurately in books, in TV, in movies. You have a person with three arrows sticking out of their chest and they're still fighting. That is not going to happen. If you're conditioned to pain, I can understand an arrow, I can understand two arrows, but three and above, your body is going to shut down. If you have a fracture where the bone is sticking out of your body, the bone has broken the skin and it is sticking out of your body, you will pass out. No matter how well you are trained, no matter how conditioned you are to pain, no amount of training or conditioning can prepare you for that sort of pain, unless of course you're such type of injuries to your warriors. But the thing is, even with modern medicine, we cannot restore complete strength to that leg after such a fracture. It is completely useless saying that, oh, the person fighting did not react to this injury because they've experienced it before. I wouldn't want a soldier who's regularly experiences open fractures in my army.
I read somewhere that in part passing out from shock is because I think your arteries either narrow or expand. I found interesting because my magic is based on control of your body. So if you can finely hone your control enough to keep your arteries open, in theory, you can stop yourself passing out, but that's all you can do. Like, that's the extent of it.
Now we are coming into the deeper details of shock.
Mm.
Shock has 4 stages. All shocks that the ones you're talking about, the arteries, is due to blood, usually due to blood loss.
Mm.
Okay, so shock due to blood loss has 4 stages. The body is smart enough to understand that it has less blood because it's lost blood. We need a certain blood pressure. I think most of your viewers and you yourself would be familiar with the concept of blood pressure. To stay conscious, we need the blood pressure to be at a certain level. If it falls below that level, we will lose consciousness. That is the body's way to protect the brain. The losing consciousness, the falling flat, is the body's way to protect itself, because once you lose consciousness, once you fall flat, your heart doesn't have to pump against the blood against gravity, so it will reach the brain easier. So what happens in shock in the first stages, to make sure that the blood pressure is maintained even after the blood loss, the body will constrict all its arteries. The basic principle is, if your arteries constrict, your blood pressure increases. If they dilate, your blood pressure decreases. But there is a limit to that constriction. Your body will keep constricting till it reaches that limit. After that limit, your body cannot constrict the arteries, but you're still losing blood and the blood pressure is going to continue falling. Now, what happens is, Newton's third law says that to every action, there is an equal and opposite reaction. The arteries that have constricted must dilate. After the first stage of shock, which we call the stage of compensation. The body is compensating for the blood loss. We come to the stage of decompensation when the body cannot compensate for the amount of blood that has been lost. So the arteries dilate, the blood just pools. There's not enough blood being flown. The blood is not flowing in enough quantities to the brain, to the kidneys, and that is when the real danger to life happens. If the person is treated in the stage of compensation, there is minimal risk to life. If the person reaches the stage of decompensation, when the body can no longer compensate for the blood loss, then there is a serious risk to that person's life. Now, in your particular magic, the control over the body can do that the blood pressure remains at a high enough level till the person can seek help. I think that's a novel way of dealing with shock.
So let's talk a little bit about losing limbs. If I think back,
Okay.
even Star Wars, like I love Star Wars, I do, especially the original trilogy. But if I think of
Uh-huh.
our boy Luke clinging to that little
Oh
spur
yeah,
after his hand was cut
totally
off.
unrealistic. I give that a pass because I like to believe Jedi are superhuman and they're strong enough to control the human body. But if it was a normal human, he would be unconscious. He would have lost consciousness, and Darth Vader would have probably killed him.
If I think of Game of Thrones, when they cut off Jaime's hand,
Mm-hmm.
that was also to me, that was a like he would have passed out situation. I
He
can't
would have.
remember. I can't remember if he did. I do remember that his stump got infected, if I remember the books correctly, which
Mhm.
it's completely legit in my opinion. Like if you lose a limb, how
It
strong is
is.
your
It
chance of
is.
infection?
It depends a lot on the method of losing the limb. I have read historical accounts where where the kings they use that as a method of justice, but they didn't want it as to be torture or or revenge against the person being punished. So what they did was the instrument that they used to cut off the hand, it was heated in a fire before they used it. So that did two things. The first thing that it did, it was perhaps the earliest method of sterilizing an instrument. They didn't understand what they were doing, but I think they noticed that if you heated a blade before using it, the chances of infection decreased.
And of course, it cauterizes the wound, because I assume that if
Of
you
course, it
don't,
cauterizes the wound. It minimizes blood loss. So the shock that happens due to blood loss basically eliminates the risk of that happening if you use a heated blade. Now, on the other hand, if losing a hand is a way of torturing that person, that character, and they use a rusty blade, then the chances of infection are incredibly high. Yes. In torture, rusty blades are very popular, and historically too, they were very popular. Now, the thing is, they didn't understand why. They just understood that it caused a lot of pain and it invariably killed the person they were torturing. And that is because of tetanus. Tetanus has been a silent killer until we, discovered bacteria, until we discovered what tetanus was and its connection to rust, iron rust in particular.
so what are the symptoms of tetanus, in case somebody out there wants to use it?
Tetanus is a pretty out there illness. It causes incredibly powerful, painful muscle cramps and spasms. You can't even think about the spasm that it causes. Your muscle will be as hard as rock. And I'm not just talking about the muscles of your arms or your legs. I'm talking about the muscles you don't even know are muscles. The muscles that you use for breathing, it will make them as hard as rock. You won't be able to contract them. And if you can't contract them, you won't be able to breathe and you will invariably die.
Okay,
So
bad way
um,
to go.
it, it is a very bad way to go. It's basically suffocating to death, but you don't even know what's suffocating you.
We mentioned torture. I've
Uh-huh.
seen and read, I guess, books and movies about people surviving things like the rack. I don't know if you know what that is. It's a medieval torture device where they lashed the prisoner to
Uh-huh.
this device that they then turned a wheel, and it kept stretching their arms and legs apart until like completely dislocated the sockets and things like that inside your body. I guess, how realistic is it that you would survive such a thing, or that such a thing would kill you, for that matter?
You might survive. It is not completely impossible. It depends on how far you go with the rack. If it's mild, they'll probably survive, but without modern medicine, their quality of life would be absolutely horrible. Even if their ligaments are torn, I'm looking up the rack right now, and that is what they do. They just stretch your joints. They just pull your joints out of their sockets. Now, in the milder form, what the first thing to go would be your ligaments and your tendons. And even if they are torn, without modern medicine, you would have no quality of life. Historically speaking, that pretty much amounts to a death sentence, because nobody cared about such people. The rack itself would be unbelievably painful.
I have read some books where they detail some elements of torture, and I just, yeah, things
Yes,
that
I mean, I think
I can't.
as a doctor, I can say with confidence that I don't think there is a single creature on the entire earth that is as good as harming its own species as human beings are. The ways we have come up to harm the bodies of our fellow species is just, it's mind blowing.
That's sadly true. Sadly, very true. So let me ask you this. What is the most annoying thing about writers when it comes to injuries?
All right, I don't think there's one thing. There are a couple of things that I find pretty irritating. I
Mhm.
think the first thing is authors taking the easy way out. They just, the character, there was a sword fight, there was a fight, and oh no, the character is gravely injured, and then they cut to a hospital bed, and the character's love interest is sitting there taking care of them. But how were they injured? What were the consequences? Did they heal properly? There's very little detail about it. There's often very little detail about it, and I think that is pretty irritating to me, personally speaking. The other thing, obviously, is, and I understand it from, as an author, I understand it as a medical professional, it irritates me. Giving every character the healing abilities of Wolverine. I was editing a story for someone yesterday. They were shot in the arm, and the doctor pulled out the bullet and pulled out the bullet without anesthesia, patched the wound up, and just sent the patient on their way. And if I ever did that, I will lose my license the very next day. Healing and medical procedures do not happen that fast. I think authors shouldn't be afraid to show the consequences of their injuries. Sadly, there is this stigma against having their heroes appear anything less than perfect. I don't think I've read a single book this year of a character that has a scar due to an injury.
So, any closing thoughts?
I think I'd just like to give advice to authors. I've met very few authors who make their own book covers. I've met very few authors who don't hire an editor. I've seen authors hire, experts in different fields, or ask experts in different fields. And I think that should apply to injuries as well, especially injuries, because that is such a huge part of your story. That, I think, often that is a major conflict, that major point of conflict, a major point of plot development in your story. And I think it is very important to get it right. So, and I'm not saying that you have to ask me, ask any person with the knowledge who can answer your questions, but for God's sake, please do not Google it, because Google will only give you two answers. It'll either say that your character is completely fine, or it'll say that your character is dead. There's no in between, unfortunately.
That's very true. And on that note, thank you very much for your time. Links to Toasty's Patreon down below. Also a link to his Discord, where I'm also a member of. And I will see you soon for another episode of Just in Time World.